What is the chance a COVID-19 test is wrong? What about 97%? A 97 false positive reading for the most common tests used to detect COVID-19 is a crime. Some experts say tourism destinations like Hawaii rely on a flawed test for visitors to avoid quarantine. Millions have been tested with a test who says no was flawed. Travel destinations like Hawaii require a rapid point of care (POC) test and RT-PCR diagnostic panel. These are both nucleic acid amplification tests, NAAT, and thus both test types are approved by the state of Hawaii. The real-time reverse transcription polymerase chain reaction, or RT-PCR, test was adopted by the World Health Organization on January 23, 2020 as a means to detecting the SARS-CoV-2 virus, following the recommendations of a virology research group, based at Charité University Hospital, Berlin, supported by the Bill and Melinda Gates Foundation. Exactly 1 year later on January 20, 2021, the WHO retracts. They don't say we made a mistake. The retraction is carefully formulated. While the WHO does not deny the validity of their misleading January 2020 guidelines, they nonetheless recommend RE testing, which everybody knows is an impossibility. The contentious issue pertains to the number of amplification threshold cycles, CT. According to Peter Borger and others, the number of amplification cycles should be less than 35, preferably 25-30 cycles. In the case of virus detection, 35 cycles only detect signals which do not correlate with infectious virus was determined by isolation in cell culture. The World Health Organization (WHO) tacitly admits 1 year later that all PCR tests conducted at a 35-cycle amplification threshold, CT or higher, are invalid. But that is what they recommended in January 2020, in consultation with the virology team at Charité Hospital in Berlin. If the test is conducted at a 35 CT threshold or above, which was recommended by the WHO, the virus cannot be detected, which means that all the so-called confirmed positive cases tabulated in the course of the last 14 months are invalid. According to Peter Borger, Bobby Rajesh Malhotra, Michael Yedden, the CT35 has been the norm in most laboratories in Europe and the US. Below is the WHO's carefully formulated retraction. The full text with link to the original document is in Annex. WHO Guidance Diagnostic Testing for SARS-CoV-2 states that careful interpretation of weak positive results is needed. 1. The cycle threshold, CT, needed to detect the virus is inversely proportional to the patient's viral load. Where test results do not correspond with the clinical presentation, a new specimen should be taken and retested using the same or different NAT technology, emphasis added. WHO reminds IVD users that disease prevalence alters the predictive value of test results. As disease prevalence decreases, the risk of false positive increases. This means that the probability that a person who has a positive result, SARS-CoV-2 detected, is truly infected with SARS-CoV-2 decreases as prevalence decreases, irrespective of the claimed specificity. Invalid positives is the underlying concept. This is not an issue of weak positives and risk of false positive increases. What is at stake is a flawed methodology which leads to invalid estimates. What this admission of the WHO confirms is that the estimate of COVID positive from a PCR test, with an amplification cycles of 35 cycles or higher, is invalid. In which case, the WHO recommends retesting. A new specimen should be taken and retested. That recommendation is pro forma. It won't happen. Millions of people worldwide have already been tested, starting in early February 2020. Nonetheless, we must conclude that unless retested, those estimates, according to the WHO, are flawed. From the outset, the PCR test has routinely been applied at a CT amplification threshold of 35 or higher, following the January 2020 recommendations of the WHO. What this means is that the PCR methodology as applied worldwide has in the course of the last 12-14 months led to the compilation of faulty and misleading COVID statistics. And these are the statistics that are used to measure the progression of the pandemic. Above an amplification cycle of 35 or higher, the test will not detect the virus. Therefore, the numbers are meaningless. It follows that there is no scientific basis for confirming the existence of a pandemic. which in turn means that the lockdown/economic measures which have resulted in social panic, mass poverty and unemployment, allegedly to curtail the spread of the virus, have no justification whatsoever. According to scientific opinion, if someone is tested by PCR as positive when a threshold of 35 cycles or higher is used, as is the case in most laboratories in Europe and the US, the probability that said person is actually infected is less than 3%, the probability that said result is a false positive is 97%. Moreover, those PCR tests are not routinely accompanied by a medical diagnosis of the patients who are being tested.
Aloha and good afternoon. My name is Juergen Steinmetz, and I'm joined by Dr. Peter Tarlow. I'm in Honolulu. Dr. Peter Tarlow is in College Station, what is in Texas. And as always, our most important topic of the day is the weather. Peter, I can tell you it's drizzling a little bit here. It's cloudy.
Oh, really?
But it's a nice day, but not sure how things are in Texas.
Well, the day started out quite cold. We had a cold front came in and it went from about 80 degrees down to about 45 in the morning. It did warm up to about 65. Beautiful blue skies, so that's the good part, but very windy today. So hopefully tomorrow is supposed to be a little bit warmer, and we are planning on having a wonderful sunny weekend so that people are excited about that. And of course, this is our last broadcast until Monday. So we'll let you know on Monday evening how the weather was over the weekend.
Yeah, and of course, it's the last broadcast we too have, but there is a lot going on this weekend because we do have a broadcast about happy tourism and the happiness business. And I can tell you, this is the absolute record participation we have registered. And you can actually still register if you want. We have with a lot of interesting people. We have people you probably recognize when you see them. And it's an event you shouldn't miss. It's tomorrow night at 8 p.m. Hawaii time or 11 p.m. in Los Angeles. Unfortunately, your time it's 2 a.m. But it's ideal for our readers in Asia and in Europe also. So go
my
to
plan is to be happily asleep.
Yeah, just go to worldtourismevents.com, worldtourismevents.com, and you can register for the happiness event and 2 more really good upcoming events next week.
And happiness is really kind of an interesting concept because I'm working on a book right now that'll be coming out in about another month on personal resilience and how to deal with COVID from a personal basis, not a governmental basis. And one of the things we know is that people who have a sense of happiness or a sense of well-being have more resistance than people who are depressed or walk around in a state of perpetual sadness. So while happiness doesn't make you well, sadness makes you sick. And it's also interesting, the United Nations does a study each year on the ranks all the countries in the world as far as happiness goes. I think in the United States, we're number 14, we have never made the top 10. Usually, I think Denmark is usually up there as number 1 as far as a happy population. And of course, like any of these types of analyses, you get the answer dependent on the type of questions that you ask. So it's how you weigh the questions, but it's still an index of nothing more than that.
Yeah, and happiness, of course, right now is a big subject. I mean, all of us going through some tough times with COVID around, and to stay happy, of course, is important. COVID is not the end of the world. And I know a lot of the governments, the tourism agencies, and people, of course, outside the travel and tourism industry, buying into this happiness concept. And so it's going to be an interesting event we're showing. Really, happiness is also big business, by the way.
Yes. And you think about it, really, the whole tourism industry is about selling happiness. No one goes on a travel trip or because they want to be miserable or they want to be unhappy. You go with the hope that you're going to have we're not always happy, but the goal is to be happy. You go on vacation for the purpose of being happy. And it doesn't matter if you're in the cruise industry or even if you're a business person, maybe you're not going to relax, but you're going with the hope of making some money that will make you happy. So I really think that people, none of us are on earth forever. And one of the things I think COVID has taught us is the importance of finding something beautiful each day in life and taking the enjoyment out of what God gives us and making each day a special moment. So people who are happy tend to live longer. They tend to get more out of life. They get to find ways to interconnect with other people. And to a great extent, that's what the tourism industry is all about. And maybe that was what happened with COVID. COVID maybe was not only an attack against the body, but it was also an attack against the spirit, because it isolated so many people and it kept them from interpersonal communication and therefore lowered our happiness index. So it's really important, as hopefully we're pulling ourselves out of that terrible year and 3 or 4 months, whatever, however you want to count the time, and get back to being happy and put a smile on our face. Because if we all smile, maybe we'll make this pandemic go away a little bit faster.
Yeah, no, absolutely.
Yes. But the pandemic is still here. So I have been noticing France is getting ready for another lockdown. Italy will be locking down. They are invigorating the AstraZeneca vaccine. So I think that's a good thing. We have about 2 million doses in the United States, and it has not been approved for use in the United States, but the United States is going to sell it to Canada and to Mexico. So hopefully, and again, I'm a firm believer, any vaccine is better than no vaccine.
AstraZeneca back on track as a COVID-19 vaccine. 2 deaths, 13 cases of blood clots in 1.6 million doses of AstraZeneca is considered a calculated risk in Germany. No direct connection between the blood clots and AstraZeneca was established. Germany is authorizing to administer AstraZeneca again as of Friday. It would have been a health disaster, a pharmacist from Cologne told eTurboNews. Today, after a new recommendation by the EU Medical Agency, AstraZeneca will be given to Germans and other Europeans again as of Friday. Federal and state authorities in Germany, together with the Paul-Ehrlich Institute (PA), agreed with the recommendation minimizing the risk of blood clots in the brain after taking the vaccine. The advantages for the vaccine are more than this small risk. The vaccine is safe and effective, according to a health department spokesperson. German Health Minister Jens Spahn said, "This was good news." After 1.6 million doses of AstraZeneca administered in Germany, only 13 cases of blood clots in the brain were detected, with 3 people dying. 12 women and 1 man between 20 and 63 years of age were among the 13 cases. The German institute is not seeing a direct connection between the development of a blood clot and the vaccine. Out of 60 million doses of vaccine people waiting to be vaccinated in Germany, 17 million had been assigned to receive AstraZeneca. German authorities promised to catch up on the backlog and added pharmacies and doctors' offices will be provided with the vaccine soon.
Yeah, as if you really look at the importance of this vaccine in Europe, it's quite important. Numbers in Germany, out of 60 million doses that are coming in now, 17 million are from this brand. So yes, it's tremendously important.
Yes, and it was the first one done. If you remember when President Trump started the whole concept of warp speed, the United States did not develop the AstraZeneca. It was developed by England, but much of the money was American money. And they were the first people to appear to have something done. In the end, of course, Moderna and Pfizer came through, and they are better vaccines. There's no doubt about it. The Americans are clearly the leaders in quality vaccines. But you know what? The least good is probably the Chinese vaccine. I would rather have that than nothing. So the worst vaccine is not to be vaccinated. And, if you can get the, and we don't know yet about Johnson & Johnson, its effectiveness. So it's pretty high. It's a single dose, but any of those vaccines is going to do people a lot of good. So if you're listening and you haven't been vaccinated, get on a list and try to get vaccinated as soon as possible. Whatever you get is better than nothing.
I mean, this is really the good part, that countries are working together
Yes.
with vaccines. So even if you look at Pfizer, the financing for the Pfizer didn't come from the US, it came actually from Germany. So there was an international cooperation. That's how we were able to develop this medicine and this vaccine, And you look at the Sputnik vaccine, what is now all over Mexico. And of course, the Chinese vaccine is in Indian Ocean and in parts of Africa. So it's not only becoming a cooperation, but it's also becoming a competition, and it will become a competition.
Well, a competition for health is the best.
Yes.
So that's not a bad competition. That's a good competition. And if each country is working to kind of improve, I think the Pfizer is a really interesting one because a lot of the funding came from Germany. The science, of course, came from Israel, and the head scientists there were Israeli, and the Americans were, I guess it's an American corporation now, or an American-German corporation. So you had really 3 countries cooperating to make that that vaccine. The same with Moderna, which was the head doctor was somebody from Greece, a Greek Jewish guy whose family was one of the few families to survive the Holocaust. And maybe God spared that family, because without him, the Moderna vaccine would not have existed. So there was again, we sometimes things work in mysterious ways. Now it's also, as you know, this is St. Patrick's week. So I wore a green shirt actually on St. Patrick's Day. I'm still wearing kind of a green sweater. And maybe we should feature just a little bit Ireland. It's a very beautiful country. If you haven't been there, when things open up, you might want to go. It's a great, if you like to drink, Ireland is definitely the country for the drink. I was there last year, and I will tell you, they understand the art of drinking, and they taught me all about Irish whiskey. And there is some food, but you start off with 2 or 3 drinks, then you have some food, then you have some more drinks. It is the most laid back country, and for people who like to drink, wow, it is just terrific. Even the police will stop and have a drink while they're on duty. So it's a really unique place. I will tell you, it really is an Emerald Isle. It's very green and very beautiful. Not the sunniest of weather. They have lots of rain, and it's of course in the North Sea, and it's cold even in the summer, but not cold. I mean, but you're going to need a sweater. But on the other hand, it's beautiful. The formations are beautiful. They have great Irish stew and Irish whiskey. And one of the interesting things about whiskey is it's spelled differently in Ireland. It has an E in the spelling. So it's a Wiskey, and that E there stands for air, or the Irish word for Ireland. So that's how you can distinguish a true Irish whiskey from a British whiskey, or a whiskey from some other places. So if you want to become a whiskey expert, stop in Ireland. It's definitely, maybe this is the week to go, though I think St. Patrick's Day is a little more celebrated in the United States and Canada than it is really in Ireland, at least with the drinking part of it goes. And interestingly enough, the other thing that kind of shocked me, of course, many people connect corned beef and cabbage with Ireland, and which was kind of unique to me, because corned beef and cabbage is also a Jewish dish. And I wonder how 2 different cultures came up with the same dish, until I discovered there is no corned beef and cabbage in Ireland. They don't use it. What happened was, when the Irish came to New York, there was a form of bacon that they wanted, and they couldn't find it in New York, but they saw corned beef, which is a Jewish dish, and they said, this looks just like our bacon. So they made it also Irish. And now we might argue that's cultural appropriation. In those days, we called it cultural lending, and people were proud when other people did it. So, but this is the week to visit Ireland, and let's get tourism re-rolling again, and put a smile on your face, have a little bit of whiskey, and the world will look a lot better after your second drink.
I can tell you, Peter, I just returned from lunch, and I went to Murphy's Grill here in Honolulu, what is an Irish, one of the oldest restaurants in downtown.
In honor of St. Patrick's Day.
And in honor of St. Patrick's Day. And yes, I saw the shepherd's pie, and there was a lot of whiskey and a lot of beer. I'm not into alcohol, especially over lunch. But you're absolutely right. And it was packed, what is a good sign, I think, during, when we're trying to get business back. Murphy's is doing well.
I'm glad to hear that. And I think it's really important when we have business doing better, it's going to help us become a little happier. And happiness really is the basis for economic development and economic success. So I think the world's goal in 2021 ought to be, let's increase our happiness. And let's go out and appreciate each day as a real gift from God, because we don't know how long we'll be here.
Yes, and one of the happy places, of course, to go and travel to is the Caribbean. And we're going to hear more about Nevis. So if you stay tuned after this conversation with Peter, you will witness a discussion about Nevis tourism and the outlook. And you also see some footage on the island of Nevis in the Caribbean.
And Nevis is quite beautiful. We spoke about St. Kitts a few weeks ago. And their one country is St. Kitts and Nevis. And if you haven't been to the Caribbean, there's nothing like the waters of the Caribbean Sea. So they're every color that you can ever imagine, and it will make you happy. So walk along the sand, enjoy the time in Nevis, and you're going to see a beautiful film. And what a nice way to go into the weekend.
Wonderful, Peter. Well, you have a nice weekend. I know where you come from. You say Shabbat Shalom.
That's right. Shabbat Shalom. Yes. And let's hope that it's a peaceful weekend and a happy weekend for everybody and for all our listeners. Okay.
Absolutely. And please make sure you don't miss our happy event tomorrow.
Yeah.
And stay tuned. And we're going to come back from Nevis.
All right. Be happy.
Take care.
Bye-bye.
Breathe. Release. Feel. Transform. Embrace. You.
Italy PM pays respects at the Day of the Victims of COVID. Italy Prime Minister chose Bergamo as the city symbol of the first wave of the pandemic to pay homage to the many deaths from COVID-19. The Premier laid a crown at the monumental cemetery, then went to the Parco della Trucca for the inauguration of the Bosco della Memoria. The PM said, "This place is a symbol of the pain of an entire nation. Today is a day full of sadness and full of hope. I would like you to feel me close, in sadness and hope," said Italy Prime Minister Mario Draghi at the memorial for the victims of COVID in Bergamo. Prime Minister Mario Draghi chose Bergamo as the city symbol of the first wave of the pandemic to pay homage to the many deaths from COVID in Italy. This was marked on the occasion of the National Day of the Victims that will unite the whole country with the tolling of church bells and moments of recollection in cemeteries. The Premier laid a crown at the monumental cemetery, then made a visit and speech at the Parco della Trucca for the inauguration of the Bosco della Memoria with the mayor of Bergamo, Giorgio Gori, and the bishop, Francesco Bisci. In his speech, Draghi spoke of the vaccination campaign. The government, you know well, is committed to doing as many vaccinations as possible in the shortest possible time. Today, the European Medicines Agency gave its positive opinion on AstraZeneca. The vaccination campaign will continue with the same intensity, with the same objectives. Increased supplies of some vaccines will help offset delays from other drug companies. We have already taken incisive decisions towards companies that do not keep the agreements. The Premier recalled how we cannot hug each other yet, but this is the day when we must all feel even more united. Starting from here, from this place that remembers those who are no longer there. In this city there is no one who has not had a family member or acquaintance affected by the virus. Then he turned to the people of Bergamo. You have experienced terrible days in which there was not even time to cry for your loved ones, to greet them and accompany them for the last time. There are many images of this tragedy which have affected everyone in Italy and in the world. One above all is indelible, the column of military trucks loaded with coffins. It was the evening of March 18th, exactly 1 year ago. This wood does not contain only the memory of the many victims to whom our moving thoughts go today. This place is a symbol of the pain of an entire nation. The President of the Republic has already testified to this with his presence at the commemoration of June 28 at the Monumental Cemetery. It is also the place of a solemn commitment that we make today. We are here to promise our elders that it will no longer happen that fragile people are not adequately cared for and protected. Only in this way will we respect the dignity of those who have left us. Only in this way will this wood of memory also be the symbolic place of our redemption. We are here to celebrate the memory so that the memory of what happened in the spring of last year does not fade. The respect that we owe to those who have left us must give us the strength to rebuild the world they dreamed of for their children and grandchildren, concluded Draghi. The whole community of Bergamo has shown its ability to react, to transform grief and difficulties into a desire for redemption, regeneration. His example is precious for all Italians who, I am sure, can't wait to raise their heads, start again, free their energies that have made this country wonderful. And I am here today to say thank you and to commit myself together with all of you to rebuild without forgetting. #rebuilding travel. 16 regions in France go back on COVID-19 lockdown. France has been placed under a nationwide curfew since mid-December. New massive measures will go in effect in France's 16 worst-hit regions, in order to curb new COVID-19 spike variant first detected in Britain, now accounts for 75% of the country's new positive cases. French government announced today that new massive measures will go in effect in France's 16 worst-hit regions, in order to curb new COVID-19 flare-up. The country's Prime Minister Jean Castex, at a press briefing said that starting tomorrow midnight, about 18 million French people in regions such as Paris, Hauts-de-France in the north as well as the Alpes-Maritimes on the Mediterranean should stay at home. The only authorized out-of-home trips will be to go to work when it cannot be done remotely, for a medical emergency, to provide assistance, to go shopping, or for outdoor exercise within a 10 kilometers radius from home. Schools will remain open. Non-essential shops will have to shut down, and inter-regional travel will be banned. Meanwhile, the nationwide curfew will be relaxed across the country and will end at 7 p.m., rather than at 6 p.m., given the longer days, the Prime Minister said. The moment has come to go further, with more demanding restrictions where the situations are most critical, said Castex. These measures that we are taking today in the most affected regions can be extended, if necessary, to other parts of the territory. The epidemic is accelerating, he said, adding that the virus resurgence looks more and more like a third wave due to the alarming spread of the more virulent and potentially more serious variant first detected in Britain, which now accounts for 75% of the country's new positive cases. France has been placed under a nationwide curfew since mid-December. Some regions in the north and southeast of the country have already been under weekend lockdown to put a brake on the viral circulation. Also on Thursday, France reported 34,998 new COVID-19 infections in the past 24 hours, the second highest daily count since last November after Wednesday's 38,501. The cumulative number of cases reached 4,181,607, while the death toll rose by 268 to 91,679. Hospital admissions increased by 75 to 25,389, while the number of those in intensive care units totaled 4,246, an increase of 27 from Wednesday. We are facing a third wave. But the big difference with the previous ones is that we now have a perspective, vaccination, Castex told reporters. So far, a total of 5,748,698 people have received at least one dose of the vaccine, and 2,393,568 got the 2 jabs. Castex said the AstraZeneca rollout would resume on Friday and he would receive the vaccine to show that we can have complete confidence. The AstraZeneca COVID-19 vaccine is effective, as underlined by the European regulator, he said, in reference to an earlier statement made by the European Medicines Agency EMA. France was one of many European countries that had suspended the rollout of the Oxford/AstraZeneca vaccine earlier this week, citing concerns over reports of people developing blood clots after the jab. As the world is struggling to contain the pandemic, vaccination is underway in an increasing number of countries with the already authorized coronavirus vaccines. Executive Secretary UN Climate Agency applauds SUNEX Malta climate-friendly travel registry. WTTC congratulated for its continuing leadership commitment on climate and sustainability issues. WTTC and SUNEX Malta jointly launched the Climate-Friendly Travel Registry. The CFT registry is a vital support for companies and communities to get behind WTTC's leadership on travel and tourism climate resilience. In a message to Gloria Guevara, President and CEO of the World Travel and Tourism Council WTTC, Patricia Espinosa, the Executive Secretary of the UN Climate Agency UNFCCC, congratulated WTTC for its continuing leadership commitment on climate and sustainability issues, even while responding strongly to the COVID pandemic. At a time when the travel and tourism sector is battling with the devastating impact of COVID-19, I am delighted that the World Travel and Tourism Council continues to focus on climate and other sustainability issues. There is no doubt that the climate challenge is presently outpacing us and requires urgent, global action. Travel and tourism has an enormous role to play and can have, through its actions, positive impacts. As the UN Secretary-General Guterres has said, it is imperative that we rebuild the sector in a safe, equitable and climate-friendly manner. Business as usual is not an option. In this context, I congratulate the WTTC on the climate-friendly travel registry launched jointly with SUNEX Malta and welcome the opportunities that this offers to travel and tourism organizations to develop, register and promote their climate strategies, plans and achievements in support of the goals of the Paris Agreement. I look forward to seeing travel and tourism organizations participating in this sectoral climate-friendly travel registry as well as redoubling their efforts to ensure a climate-neutral and resilient world by 2050 at the latest. SUNEX Malta President Professor Jeffrey Lipman in welcoming this development noted the strong relationship between climate-friendly travel CFT, low-carbon, SDG-linked, Paris 1.5 aligned and the UN 2030 SDG, 2050 Paris Agreement, Roadmap for the Future of Humanity. The CFT registry is a vital support for companies and communities to get behind WTTC's leadership on travel and tourism climate resilience. It is the way to turn climate declarations into UNFCCC compliant action and deliver practical programs for greenhouse gas reduction and for building in sustainability. We are delighted to work with Gloria and the WTTC team to roll out this initiative to travel and tourism stakeholders as we look towards the 26th Colombian Pesos session in Glasgow at the end of the year.